For more on the MERS outbreak and efforts underway to stop its spread, I was speaking to Stephen Morrison. Now, he's with the Center for Strategic and International Studies. He is the Senior Vice President and Director of the Global Health Policy Center there.
I don't think that this particular episode is cause for panic. MERS itself as a coronavirus is difficult to contract. It's not as easily transmissible. If you put this in context, SARS, when SARS, which was the first highly infectious coronavirus, upper respiratory virus, appeared 2002, 2003, it spread to 4 different continents. It infected over 8,000 people. It killed almost 1,000 people. So put that in comparison with this, which I think will be contained and rolled back. So that's the reassuring piece. The other cautionary piece is that this shows that every country, whether it's a highly developed country like Korea or a very undeveloped country like Sierra Leone or Liberia, has to have the basics in place in order to prevent, detect, respond to these pathogens as they come in. They have to be able to be surveilling, to be able to detect them as they happen, and they need to have the basic capacities to do that as are outlined under an international convention, international health regulations.
The South Korean Prime Minister, and I want to get his quote exactly right, he says the most important thing is to stop the spread from hospitals. And you were telling me that that's one of the unique problems in South Korea, the hospital settings. Talk to us why this can flourish and actually grow as a result of that.
In Korea, oftentimes, family members come and help provide care for their relatives that are in the facility. And that only magnified the problem. If you think back comparatively to the Ebola outbreak, who were the people who died, the largest numbers that died in the early phases of Ebola? They were the family members and they were the caregivers. So healthcare workers and those inside the institutions are very vulnerable, particularly in the early phases of these outbreaks, when people may not understand, well, what is this we're dealing with and what are we supposed to do?
Are there best practices or anything learned from, let's say, the Ebola epidemic or other outbreaks that should be put in place initially when something like this happens?
Well, you need to have adequate surveillance, so you have to be able to have a system that is monitoring and reporting, and when odd things happen, they can bring those forward, and you need to have trained epidemiologists and good laboratories, and you have to have protocols, developed protocols and trained personnel to follow those. And you need a data system so that you can record and share this information. And you need to be open in terms of sharing globally or internationally, because oftentimes, as we've seen here, it's an importation of something that's alien, but you have to be able to communicate back as you're trying to puzzle through, well, what is this? So there has to be a good open exchange of samples and information that bridges continents.
One final question, ripple effect, Hong Kong, there's concern in China. Do you see this spreading further? Can you write the final chapter on this? How long are we going to be talking about this?
I think one of the ripple effects, of course, will be that travel between Saudi Arabia and the Emirates will be much more carefully monitored. Coming into whichever country you're talking about, people will become better prepared in detecting and in looking out for this. It's a little difficult when you think about it. I mean, MERS, the symptoms oftentimes are not all that dangerous. They are flu-like symptoms, they're cough, they're headaches. And of course, the number of reported cases show about a 30 to 40% fatality. So in many cases, it can really escalate, particularly if your population is immune deficient or is elderly or has other chronic diseases, diabetes, or other things that compromise them. Then that population is very vulnerable.